You can now start your role play.
Good afternoon, I am Nurse Randy Jones. Could you please share the reason for your request to speak with me?
Hello, Nurse Jones. I would like to talk to you regarding my mother's care.
Sure. Could you kindly provide your mother's name and age for confirmation, please?
Her name is Evelyn Charlotte, aged 75.
Thank you for your confirmation. And how may I address you?
You can call me Mihiraa.
Mihiraa, what would you like to discuss regarding your mother's care?
Nurse, I heard she might need a ventilator, and I'm really worried about her. Could you please update me on her condition?
I completely understand your worry, Mihiraa, and I appreciate your concern for your mother. Yes, your mother has been admitted with pneumonia, and regrettably, her lungs have become inflamed and filled with fluid or pus. As a result, we needed to provide support for her breathing through a ventilator.
Oh no, that sounds serious. Could you please explain how the ventilator will help in her recovery?
Absolutely. The ventilator plays a crucial role in supporting your mother's breathing by delivering oxygen to her lungs and removing carbon dioxide from her body, which is essential, since her lungs are currently unable to function effectively on their own. As for her overall condition, Mihiraa, she's stable at the moment, but pneumonia can be quite severe, especially at her age. We're closely monitoring her and doing everything we can to ensure her comfort and recovery. Your concern and involvement are greatly appreciated.
I understand. Could you please provide an estimate of how long she might need to remain on the ventilator? I mean, is there a general timeline or criteria for when she might no longer require its assistance?
I'm sorry for not being able to give you an exact timeframe, Mihiraa. Every patient responds differently to treatment, making it challenging to predict precisely how long your mother will need the ventilator. However, please know that we're continuously monitoring her progress, and will adjust the ventilator's support accordingly as she improves. Our aim is always to gradually reduce reliance on the ventilator, and ultimately wean her off it, as soon as it's safe and feasible to do so. I hope it is clear to you. Do you have any concerns or questions, Mihiraa?
Thank you for explaining. Are there any alternative treatments or procedures we should consider?
At this point, the ventilator is the most effective way to support your mother's breathing, given the severity of her pneumonia. We're also administering antibiotics to treat the infection and providing other supportive measures to help her recover. Rest assured, we're exploring all available options and providing the best care possible for your mother's well-being, Mihiraa.
That makes sense. Can you please keep me updated on any changes in her treatment plan or condition?
Of course, Mihiraa, we'll make sure to keep you informed every step of the way. And please know that your mother is receiving the best possible care from our medical team.
Thank you so much, Nurse Jones. I really appreciate all that you're doing for my mother.
Before we wrap up, let me summarize the key points of our discussion today. Mihiraa, I appreciate your concern for your mother's well-being. Your mother has been admitted with pneumonia, leading to inflammation and fluid accumulation in her lungs, necessitating the support of a ventilator. This device assists her breathing by delivering oxygen and removing carbon dioxide. While we cannot provide an exact timeline for her ventilator use, due to varying patient responses, we're closely monitoring her progress and aiming to gradually reduce dependence on it as she improves. We're also exploring all available treatment options, including administering antibiotics to address the infection. Your involvement and questions are valued, and will ensure to keep you updated on any changes in her treatment plan or condition. Rest assured, she's receiving the best care possible from our medical team.
Thank you so much, Nurse Jones.
You're welcome, Mihiraa. It's our duty to ensure the well-being of our patients, and we'll continue to do everything we can to help your mother recover. If you have any further questions or concerns, don't hesitate to reach out.
I will. Thank you again.
You are very welcome, Mihiraa.